Warren.
Thank you, Mr. Chairman. So I want to see if I can just ask some more questions along this line. We all know that the Affordable Care Act allows employers to offer financial incentives to their employees in order to encourage participation in these programs. But one thing the ACA doesn't do is eliminate the protections already in federal law for employers so that they cannot discriminate against their employees on the basis of genetic information, health status, or disability. And, these protections were put in place by two very important pieces of legislation, the Americans with Disabilities Act and the Genetic Information Non-Discrimination Act, or GINA. And this is a bipartisan bill. Senator Ted Kennedy worked with a number of folks on this committee. And last year, Senator Enzi and I wrote and passed new legislation strengthening GINA protections so that personally identifiable genetic information collected through federal research can never be made public. So, in short, our nation's non-discrimination laws say that employers can collect sensitive medical information from their employees only if providing that information is voluntary, meaning the employee can decide to say no. So I just want to start by asking Ms. Mathis, what types of personal health information do employers typically ask for as part of wellness programs?
So I've seen these health risk assessments ask about all manner of health and medical information on a variety of levels of detail. I'll give you some examples. Specific cancer diagnoses such as breast cancer, cervical cancer, prostate cancer, weight, height, BMI, whether you're being treated for depression or bipolar disorder, specifics about your depression, such as how many times you felt depressed in the last week, whether you had crying spells in the last week, how often you felt like people disliked you, how often you feel happy, whether you've been diagnosed with heart disease, stroke, high blood pressure, high cholesterol, angina, bronchitis, COPD, hepatitis B, obesity, high blood sugar, diabetes, or sexually transmitted diseases, to name a few, whether you're pregnant, whether you're trying to become pregnant, how old you were when you first became pregnant. And those are some of the medical things that they ask about, lots of other questions about all sorts of other life habits.
Okay, so this is some really sensitive information, and it's supposed to be voluntary to hand it over.
That's right.
So let me ask about that. Mr. Bird, when you were the CEO at Safeway, you set up a wellness program that you called completely voluntary at the same time that families were charged $1,500 more in healthcare premiums if they didn't participate in the program. And in fact, I think you said that you thought the penalty wasn't high enough, and you lobbied hard to get the limits relaxed. The quote is, legislation needs to raise the federal legal limits on the size of these penalties. And I know that today you run a business that designs these kinds of penalties for other companies. So my question is, when it costs an employee $1,500 or maybe more a year to get health care coverage because they don't want to have to share this kind of confidential medical information with their boss, or because they can't pass a biometric test, I don't understand how that connects then with the rules on discrimination. It sounds a lot like discrimination.
Well, we've been tested on that numerous times, and we're never accused of discrimination during the 10-year life of the program. What you're referring to about my desire to raise those limitations that were in HIPAA, HIPAA originally in '96 allowed a 20% premium differential based on behavior. And if you look at something like smoking, the impact that smoking would have, Toby Cosgrove used to say that smoking alone would cost about $3,000 more. And I didn't say in my direct testimony, but I'll say now that in our experience, about two-thirds of, on average, two-thirds of that comes immediately back to the employees as a reward for making those standards. And so it's not like they were charged $1,500. And the $1,500 one, that would be if there was a spouse and an employee. So we think that I was questioned by the by EEOC, I was questioned by the Labor Department, And at the end of a 45-minute interview, I was told that I had properly followed the letter and spirit of the law. We had not been accused of discrimination during that time period. And the person that was interviewing me actually wrote the HIPAA regs in 1996, or had a role in that, and said that if I ever opened up a Washington, D.C. office, they'd love to come work for
Well,
me.
I'm glad that's the case, and I'm now over time, so I want to be respectful of the time here. But I have to say, when you charge differentially $1,500 or sometimes more, and that can happen because people don't want to reveal very sensitive, personal medical information, that's a penalty. And paying a penalty may be legally all right, although, as I understand it, the courts have now said that the EEOC is going to have to go back to the drawing board on the latest iteration of what the rules are. But we have not repealed our laws on discrimination. And I just want to raise the issue that I think the question about what constitutes voluntary on this kind of sensitive information is one that we've also got to keep on the table and maybe do some pushing in the other direction as well. I apologize for going over, Mr.
May I make a
Chairman.
quick comment? This information is not revealed with the company, it's revealed with the health plan. There's an absolute firewall between the health plan and the company, and in fact, we fire people who break that health plan because we have a tracking system. Every other health plan I know has a tracking system. If you break that firewall, you get fired.
You know, Dr. Rose, all I want to say is what the law says is that the revealing information has to be voluntary.
It is, but it's with the
telling
voluntary
people
with the health plan.
it will cost you $1,500 if you don't reveal very sensitive medical information, I think stretches the bounds of what constitutes voluntary. Thank you, Mr. Chairman.
Thank you, Senator Warren.